Hey to the most amazing nurses. It is Dr. V here with Morning Infusion with Dr. V podcast, where we are intentional about teaching nurses how to work from anywhere around the world, making money and owning your own time, building profitable nurse coaching and consulting businesses. You will hear from amazing guests that have grown their companies and want to share insight into how you can do the same to change the face of healthcare as we know it. If you want to grow your businesses and leverage your knowledge as a nurse to grow wildly successful businesses at the top, instead of working your way to the top, head on over and join our Millionaire Nurse CEO group on Facebook, where you can ask questions and get updates on our live and virtual events to help you grow your businesses. So welcome everyone to Morning Infusion with Dr. V. So first of all, I want to ask everyone to like and subscribe to the channel on YouTube, okay? And also to download the podcast on Apple Podcasts, because that increases our opportunity to get across to everyone, because nursing and healthcare is an amazing profession, and we want to make sure that we highlight everyone that is in the profession. So today, we have Dr. Maya. So Dr. Maya is a friend of mine. We're actually in a coaching program together because, of course, I always believe that a coach needs a coach. And so we are in a coaching program together. So Dr. Maya is amazing. And so, Dr. Maya, I want you to introduce yourself to the world.
Of course. So first of all, thank you so much, Dr. V, for having me this morning. I am so honored to join you today and talk about this very important topic we're about to get into. But before we jump into it, I am Dr. Maya Edie McCarthy. I am a board certified pediatric hospitalist. I am also a wife, a mother, a child of God, a sister, a daughter. I am all of those things, but the best thing that brings me so much joy is being a wife and also a new mom. I think I can say I'm a new mom now. My daughter is 3 years old, so I think I'm still in the new mom category. But, I also enjoy the work that I do in the hospital. I take care of children all day long. I've been doing it for the last 16 years. I'm almost to 20. I cannot believe I've been doing this for so long, but that's what happens when you're having fun. And so I primarily operate in the hospital. So I take care of children who are sick enough to be hospitalized, and I do some teaching as well. So I'm very involved in medical education with students and with residents.
I love it. I love it. I love it. I love it. So you hail out of Atlanta, Georgia. And
Yes.
so one of the things that, so let's talk about like from the very beginning, because I always like to go back to your roots. So did you know, so Dr. Maya, of course, is a pediatrician. And so did you know that you wanted to be a pediatrician, or did you know you wanted to be a physician? Like, how did that come about?
So, Dr. V, it is a long story, but listen, I'm going to try to give you the abridged version, but because it's important to hear. It's important to hear. So I was born at 26 weeks gestation in small town, Georgia. So I failed to mention I'm a small town girl. I am from South Georgia. And when I was born, they did not know what to do with me because I was not responsive, no signs of life. And they just kind of put me to the side and said to my mom, I don't know if she's going to make it. We're going to do our best to work on you because you're sick. And then, they heard me cry and they're like, oh, well, I guess she is alive. Somebody go and resuscitate her, please. And so they did that. And I spent about just over 2 months in the ICU, just growing and gaining weight. And so at that time, we did not know as much as we do now about the premature infant. And so they did not know what to expect. So, my parents were told, oh, she's not going to speak. She's not going to walk. She's not going to, development's going to be off. They just know what to think about me. And so clearly I am just fine. But I got really interested in what my pediatrician was doing because I had to see him all the time. And that interest really led into middle school when I became a candy striper at the hospital. Absolutely, I did. So my job was just primarily to hand out water and newspapers to the patients, but it really gave me an up close and personal look at what healthcare providers do. So I got a chance to see what the nursing staff was doing, what the physicians were doing, and it just really continued to foster my interest in healthcare. And so moving along, I get to high school. I actually did a summer program at Xavier University my junior year, like the summer after my junior year, to make sure, again, this was something I really wanted to do. Immersing myself in the sciences. And indeed, the answer was yes, this is still what I want to do. And so when I entered college, I knew that I wanted to pursue a career in medicine. And so I was a biology major. I took all of the classical sciences. I did the whole applied for the MCAT. I took the MCAT and then applied to medical school and got in. Thankfully, I had a full ride to medical school. I did not pay anything for tuition. All I took out loans for were for cost of living, and that helped so much. There we are. I went to medical school and finished there and did my pediatrics training at the Medical University of South Carolina in Charleston. And then I came back to Atlanta to start my career as a pediatrician. So I kind of always knew from the beginning I wanted to be a physician, specifically a pediatrician, because this was my way of giving back to people who had given to me so very early on in my life.
That is a wild story. I mean,
Yeah.
it's wild for so many reasons. It's wild because, number one, because you spent so much time with the pediatrician, right?
Oh, yeah.
So, because you spent so much time with them. And then outside of there, you had a full ride to school for the person who they didn't think was going to live, who was over there in the corner.
Listen, it's by the grace of God. That's what it is. It's by the grace of God. Yes, ma'am.
Wow. 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 Okay. All right. So now let's get into this.
You didn't know what you were expecting this morning. It gets better. It gets better. Keep listening. Keep listening.
Okay. So tell me a little bit about medical school, because we talked about how tough medical school was.
My God, my God. So, I finished high school as a salutatorian of my class. So, I was used to not having to study as much and still, maintain good grades. And so when I got to Spelman, I went to Spelman for undergrad. I thought that that would be the case as well. And I realized quickly I had to step up my study skills and really, adapt a new way of studying and figuring out what worked best for me. And so, because everyone at Spelman is smart, everyone's the valedictorian or the salutatorian of their class. I mean, it's not unusual at all. So when you're with a group of women like that, you have to really step yourself up a lot bit actually. And so then when it came time to go into medical school, having been exposed to the classical sciences already, maybe the first half of that first year was really a review for me because I'd already been exposed to it. But the thing I wasn't really prepared for was just the water hose of information that you receive. I mean, it's all coming at you hard and fast, and you have to find a way to really integrate that information that you're learning, retain it, and then take tests about it. And then you have to do it very quickly. And so I then had to change the way I studied. I mean, I can remember a time, Dr. V, I was up late studying for a biochemistry test. And I was up so late, I overslept. And I woke up, I was like, oh, I'm late. Oh my gosh. So I boogied on down to the school. And of course, I was late for the test, a good like 30 minutes or so. We only had a certain amount of time to take the test. And that's all the professor gave me to take. And I did the best I could, but I did not do well on that test. And so what did I learn about that? It's like, Dr. Maya, you cannot stay up early, late, studying for tests. So you've got to find a better way to retain this information. And interestingly, I actually became a transcriptionist for my class. So back in the day when I was in medical school, we didn't have the things we do now, but we actually hired students to transcribe the lecture. So I always found that I did the best on the lectures that I was responsible for transcribing because I realized I am an auditory learner. If I had just gone to class and just listened and not really paid too much attention to furiously scribbling down notes, I might have retained the information a lot better. So once I figured that out, really my success in medical school got better. My performance got better. Now, that's not to say there weren't any, things that still were stumbling blocks, because there are always standardized tests that you're taking throughout medical school. And I had to take my step 1 exam several times. I did. Again, I had to incorporate what I knew my learning preference was into studying for this standardized exam that was very high stakes. And once I figured that out, not a problem.
I think that's very that's key, because that's one of the things that I had to learn, because in nursing school, I'm sure that I'm almost sure that it's a little bit less than what you guys have to learn in medical school. But the reality is that it is water hose. Like, you get a lot of information in a very short amount of time. And and understanding what type of learner you are. And so where you are an auditory learner, some people are visual learners. Some people are kinesthetic learners. I'm a kinesthetic learner. Like, you can tell me, we could talk about it all day long. Once I do it, I got it.
That's it. That's it.
So like, it was, it's really important for people to learn what type of learner they are in order for them to move forward effectively, in order to be able to succeed in any in any area that they are in. So that is super, super key. So did you encounter any other issues outside of like your learning style and trying to figure that whole thing out?
Yes, and I am not afraid to share this. I actually don't think that I've talked about this to anyone publicly until now, but it's going to help somebody.
Okay.
And so, I mentioned I had to take my step 1 exam several times. So much so that I got a letter in the mail from my medical school saying, if you don't pass it this next time, we're going to kick you out of medical school.
Wow.
That's just how high stakes this exam was. And so I knew at that time, I was like, okay, I'm going to take some time off so I can really focus my studying, figure out what works best for me, do that, and incorporate those things that work well for me, because I know that I can pass this exam. And certainly the next time I took it, I blew it out of the water. So even though I had to take it several times, what I learned in that process, especially under the pressure of being threatened to kick out of medical school, all right, I have got to figure something else out. I know I am capable of doing this. And so let's figure out what else to do. Now, not to mention, once I got past that standardized exam, then I moved into my 3rd and 4th year of medical school. As a medical student on the clinical floors now, here I am faced with a new set of challenges. Specifically, the expectation that providers have to always know what the plan is for a patient, always. And so I can recall like it was yesterday, and I tell my residents and students this all the time. I stepped out of a patient's room. I had been talking to the family that morning, and I walked out the door to face a group of our team of medical providers. So the attending, the nursing staff was there, the other medical students, residents, everyone was there, and all eyes on me. And they asked me, the attending asked me, what's the plan? And here I am as a 3rd year medical student. I didn't know anything. And so, I didn't know what to say. And I remember him saying to me, don't you ever not know what the plan is. You had better know what you need to do with this patient. Even if your plan is, I'm not sure what the plan is right now, you need to have an answer other than I don't know. And so from that point on, I always made sure I knew everything there was to know about my patient. And I would go over what I thought the plan should be with my upper levels, so my attendings, my residents, to make sure that that didn't happen to me anymore. And especially as a brown skinned girl in an environment that was not very friendly always to me, I had to make sure, yes, that I did double the work to get half of the achievement.
I love it. I love it. I love it. You know, it's interesting that he said that you don't need to say I don't know, but you need to say I'm not sure. This the same thing.
It's the same thing. It really is the same thing. It really just frightened me at that moment. Like, I'm sweating bullets. People are looking at me like, what's the plan? I'm like, I don't know. I'm just a third-year medical student. But I always then take that and teach my residents and my students in particular. I'm always encouraging them to come up with a plan, even if you don't know if it's correct or not. I just want to hear what you're thinking, because that's what my job is. I am here to coach you and to help you develop the assessment and the plan to know how to take care of the patients that we see the best. And you won't know how to do it unless you try, but you have to create that environment that makes it safe enough to try.
I love it. I love it. I love it. So we're going to go to another commercial, and then what we're going to do is we're going to talk about you and your little baby when we get back.
Hey to the most amazing nurses. It is Dr. V here with Morning Infusion with Dr. V podcast, where we are intentional about teaching nurses how to work from anywhere around the world, making money and owning your own time, building profitable nurse coaching and consulting businesses. You will hear from amazing guests that have grown their companies and want to share insight into how you can do the same to change the face of healthcare as we know it. If you want to grow your businesses and leverage your knowledge as a nurse to grow wildly successful businesses at the top, instead of working your way to the top, head on over and join our Millionaire Nurse CEO group on Facebook, where you can ask questions and get updates on our live and virtual events to help you grow your businesses.
So we are back. So tell us about you once you started to try to get pregnant.
Yes. Okay. So fast forward lots of years. So unlike my medical school classmates, I got married later in life. So, but before that happened, I remember visiting my OB for my annual visit at 34. I was single, nobody in sight as a prospect to date. And she just said to me, she's like, you know what? If you want to have a baby at some point in your life down the road, you're going to have to preserve your fertility. You're 34. We know that around 35, your egg count drops off significantly. So if we're going to try to harvest any of your eggs, now's the time to do it. The younger, the better. So I went through that process of harvesting my eggs and was, normally a good yield is about 15 to 20 eggs. For me, I only got 6. But that was when I realized I also had PCOS, and that might have been part of the problem.
What's PCOS? Because everybody don't know.
Okay. Yes. So PCOS is polycystic ovarian syndrome. It's really PCO. It's a multitude of clinical symptoms. That's really how we diagnose it. But the hallmark of it is irregular menstrual cycles, along with some metabolic derangements. So insulin resistance can pop up here. Hormones related to growing hair in a male pattern can also happen. So some women might have extra sideburns or hairy places underneath their chin, on their lips. And then sometimes some women are overweight with PCOS. That was my issue. I was overweight and I had insulin resistance. And when I thought back on it, I really did have the irregular menstrual periods, maybe 3-4 a year. And so that is not normal. And then on the flip side, there are some women with PCOS who are not overweight. They are thin, but they still have those metabolic derangements that are so key with diagnosing PCOS. So you have lots of follicles in your ovaries, but not all of them have mature eggs. And so that's what the case was for me. I had lots of follicles, but most of them were empty. There were some that did have mature eggs. And so that in and of itself does make it a challenge to conceive. So as you can imagine, you don't have many mature eggs. It can make it challenging to conceive, and you don't ovulate every month. So that's very difficult. So I went through the process of harvesting my eggs and put them on ice and went about my life. And my husband and I met when I was 36. We got engaged when I was 38. We were married when I was 39. No, we got engaged when I was 37. We got married at 38. And then at 39, we went to see the fertility specialist because I knew I was going to have a challenge trying to conceive. And so we went to that fertility specialist, the first appointment, really with hope, thinking that this was going to be our, answer to help us grow our family. My husband has 2 children from a prior marriage, but I had none, and we wanted to have a child together. So we're going to that appointment full of hope. My husband had to have a procedure, and that did not go well. And so she sat us both down. The physician sat us down and said, you will never have your own biological child ever. Now, it's very rare in medicine that we use the word never. Usually there is a way to accomplish the goal that you're trying to achieve. So when I heard that word never, Dr. V, my entire world just came crashing in front of me. Like I didn't hear anything else she said to me. All I heard was never have a child. And I heard something about adopting an embryo, using donor eggs, or using donor sperm. And nothing is wrong with any of those options. It's just that I was not ready to hear that. That's not what I was expecting at all. And so, I really just honestly fell into a depression, to be quite honest. I mean, we both left that appointment dejected and, feeling like all was lost. And so wallowed in this despair for months until, something just sparked in me. And it's like, wait a minute, there has to be another solution. There has to be another way. So I went out and found a reproductive urologist for my husband, a urologist that only deals with reproduction. And then I found when he got connected with that physician and the doctor said, oh yeah, I can help you create children. This is not a problem. My husband had had a vasectomy. And so, of course, it was too old to reverse. And so he said, well, we'll just have to go to the source and we can do that. That's not a problem. I can do that. So we were very relieved to hear that, he had a solution to the problem. And so then I transferred into the clinic to work with a reproductive endocrinologist there. And he was just honest with me. He's like, Maya, I'm not going to lie to you and say that this isn't going to be a challenge, but am I going to help you? Absolutely, I am. So I want you to undergo another cycle of egg harvesting. Let's see what we get. So I started again, all the medications, all the shots, all of that. Again, I did not respond very well to the medication, but we were able to eke out 3 eggs. Now, normally a physician will cancel a cycle if they have that few eggs to actually go after to retrieve. But he knew how important this was to us and how dedicated we were to growing our family. So he did it for us. And so I took the 6 eggs that I had previously on ice with the 3 that I now have, put them together. We fertilized them all. And once all is said and done, they do go through a period of attrition. Not all of the eggs our embryos are going to make it to at least day 5. They watch them until day 5 or day 6 as they grow in the lab. And so by the time all was said and done, we did send 4 off for genetic testing. And I did that because of my age. And 2 came back completely normal, very high grade. and one is our 3-year-old daughter, and we have another embryo that is on ice now.
Yay!
Yes.
Super exciting. That is just super exciting, super complicated. Like it is like I have never heard of a reproductive urologist ever.
Yes. Yes. I had not either until I was just like, now wait a minute, there has to be something else out here. And so I just started Googling and started researching different fertility clinics. And sure enough, this physician came up, and we got in to see him, and he was wonderful. Wonderful.
I love it. I love it. I love it. Now, this is what I love about you. I love this. I love that. First of all, you have turned every bit of your pain, like from the time that you were over there in the corner and they thought you weren't gonna live, okay, into being the pediatrician, all right, into learning your learning styles, into passing that test, then from not having a child, and then turning that and forging forward, no matter what, right? And it amazes me how some people they don't go forward. Like
Yeah.
why do you have that tenacity? Like where do you get that
Honestly, I think in two things. Again, by the grace of God, everything that I do is by the grace of God and his strength. Sometimes when I don't have it, I have to lean on his strength to really carry me through. And then the other piece of that is my parents, the way that they raised me, to never give up, to continue persevering. There is another way. My dad always says to me, when I face something that is challenging or hard or difficult or seemingly unsurmountable, he always says to me, let's do the next best thing. So, what is that next best thing that you can do? And I always figured out what the next best thing was. Now, it didn't always happen immediately, but I did take some time when I was faced with challenges to figure out what's the next best thing that I can do. My dad and my parents, both of them, instilled in me a very strong work ethic. I always saw my parents working hard, and I saw them achieve academically. And so they too have their doctorates in education. They're not medical doctors, but they're doctors in education. But I saw them do that while they were raising us. And I have two brothers. And so, it was busy in our house growing up with their pursuits and our activities. They never missed. For me, it was piano. They never missed a recital. They never missed taking me to rehearsals and practices. I mean, all of those things they were able to do and still nurture us in such a way that these traits have now been instilled in me. And these are the things that I'm hoping to instill in my daughter as well.
I love it. So now tell me, you now are a fertility coach.
Yes.
What made you want to become a fertility coach?
Okay, so here's the third part of the installment to the story. I'm telling you, it just gets juicier. All right, so I get to the fertility clinic, and after we harvested the eggs again, I had that one embryo or two embryos that were normal. We transferred one. Now, it's unusual for the first transfer to stick. Mine did. And so because I focused on that at that time, I couldn't do anything about the number of eggs that I had left. In fact, we're all born with all of the eggs we're going to have as women when we're in our mother's womb. So at 20 weeks gestation, you have the most eggs you're going to ever have in your life. And from that point, they just start to decline. It's just what happens for women. So I knew I couldn't do anything about the number, but I could do something about the quality of the eggs that I did have left. And that's what I really focused on. And so, I have to say, I have to believe, some of that actually did help in making my transfer process successful. So I'm pregnant, and it was not easy. It was not easy at all. I had complications from the beginning. So I was about 70 pounds heavier than I am now. So well in the 230-pound range. And I'm 5'4". So you can imagine I was morbidly obese as a pregnant woman. I had chronic hypertension. I'd had hypertension for years. But the minute I got pregnant, my hypertension just went haywire. Could not control it well. And then I had asthma that we were dealing with too. And so I'm pregnant. I have some vaginal bleeding here and there. And then I remember being at work one night, having another episode of vaginal bleeding. And I immediately went to the hospital to be evaluated. Everything was fine. I mean, my daughter was just fine. She's like, what are y'all writing about? I'm fine. And so, but the physician put me on, my OBGYN put me on bed rest the very next day. And so that was March 4th. To 2020. And so, oh, hello, here comes the pandemic. A couple of weeks later, 2020, the world shuts down. And so I'm stuck in my house on bed rest and trying to do my best to continue, making sure my baby would be safe. And so I look back on it now and I see, during that time where I was starting to get sick, but I didn't know it. And so May 15th, we went to a maternal fetal medicine appointment. At this point, my husband could not go to any more appointments with me. He went to 2 for the entire pregnancy, and then the world shut down. But he always drove me to the appointments and waited in the car while I went inside. And I remember walking out the door and the physician caught me and said, let me check your blood pressure. We forgot to do it when you walked in. And so she checked it and it was elevated. And she asked me how I was feeling. I was like, I'm feeling okay. I don't feel any different, And she said, well, I'm going to send you to the hospital. And so I was like, okay, well, do I have time to go home and get some things to prepare? She's like, no, you need to go right now. I'd also been diagnosed with gestational diabetes at that time. And so I had to start insulin. So I get to the hospital, get checked in, get blood work drawn initially, and they discover that my liver enzymes were elevated. And then, of course, I had to collect my urine because what they were looking for was protein spilling in my urine to make sure I wasn't developing preeclampsia. So the visit went from, oh, I don't think we're going to deliver you this weekend on a Friday afternoon, but we're going to continue drawing this blood work every so often. Every time they drew my labs, my liver enzymes doubled. And I continued to collect my urine for the protein. And I remember Saturday night, early that Sunday morning, I asked my nurse, I was like, just give it to me straight because I'm not feeling good. I'm having pain, like a belt around my waist. It's now settled over my right side. I'm not feeling good. What's going on? And so she told me, she's like, yes, you are spilling a lot of protein in your urine. So here I was with preeclampsia. And every time we've drawn your liver enzymes, and it had been like 4 times now, they doubled every time. And so I was developing HELP syndrome. Mm-hmm. And so I spent that Saturday, early Sunday morning, looking up the latest recommendations from the American College of Obstetrics and Gynecology about preeclampsia. I knew I wasn't going home. I knew I was going to have to deliver a baby. I asked to see the neonatologist. I asked for the steroid injections to help mature my baby's lungs. And here I am Sunday morning at 25 weeks gestation, my doctor coming in and say, I don't have time to induce you. We have to deliver you right now. So I got started on my magnesium, went down to labor and delivery, where I sat with the nurse. It was just the 2 of us. And I looked at her and I was like, am I your only assignment today? And she said, yes. I said, well, I know that's not usually good. If I'm one-on-one with you, that must mean that I'm really sick. And she's like, yes, ma'am, you are. And I didn't realize how sick I was, but I asked her, I was like, on a scale of 0 to 10, how sick am I really? She's like, you're an 8. If we don't deliver you now, we're going to lose you and your baby. And so, Dr. V, I had to have end of life conversations with my husband asking him, save my daughter. I know where I'm going. I'm okay. I'm at peace with that. But save my child. Meanwhile, he's hearing from my parents and they're saying, no, no, no. We save our daughter. She can have another baby, but there won't be another Maya. And so I'm having to instruct him on what to do. I'm FaceTiming everybody that I was close to, my pastors, my friends. I made a video for my daughter just in case I didn't make it through the process. And the next thing I knew, I had an epidural in my back. I was on the operating room table. I heard her cry. They let me see her for 2 seconds. And she was whisked away to the NICU. That's the last time I saw her until she was about 3 days old. They did not allow me to go up to the NICU to see her because I was still sick. I was still dealing with hypertension and preeclampsia really at that time, and was still on magnesium. And so my husband took over, being her parent and caring for her while I was still in the hospital. I stayed there for about a week after she was born. And then when I got discharged, we spent 81 days going back and forth to the NICU every day, going to see our baby. In the middle of a pandemic, we could only see her for an hour at a time every day. Only one of us could go. My husband let me go because he knew how important it was for me to establish that bond. And so I could really, increase my breast milk because that's the only thing I could do for her. I went home and cried after I was discharged for about a good week because it just, reminded me again of the parallel between my mother and myself. We delivered premature babies in very traumatic situations, and I couldn't have my mother there with me to help me deliver. But I could have her after the birth was over. We would talk. And sometimes I just had to call her to cry because I went to go see my baby every day for 81 days. And I would see women leaving the hospital with their babies, knowing that I couldn't take mine home.
Well, you going to have to stop, okay? Okay.
I know, Dr. V. Listen, I done cried all kinds of tears over this. It's just a testimony that, God is still in the business of working miracles. And it is the exact reason why I started fertility coaching. Number one, I never wanted any woman, particularly a woman of color, to have to go through what I did with my infertility process. If I can help any woman to really make that journey smooth and easier and less confusing, I will do it. And so I started the business originally with that goal in mind. And now as I've been coaching, I realize there's something else that I am doing as I'm coaching women that I didn't expect that I was going to be able to be honored to do. So some of my clients that I have actually conceived very early on after working with me. And so now I'm helping them walk through their pregnancy. Now I'm always going to ask them to talk to their OBGYN about whatever complications they're having. But a lot of the work that we do really starts with their mind. We know that the mind and body connection is so very strong that, especially when you're in a state you're carrying a baby, it's so important to strengthen that connection because it does affect the baby and the baby's growth and health. And so I found myself even mitigating the maternal morbidity and mortality that we are having in this country by helping them walk through their pregnancy, giving them things to ask or think about, to talk to their physician about, making them aware of those early warning signs of preeclampsia. So because we know that, again, in this country, maternal morbidity and mortality is at its worst. And if you are a woman of color, you are almost 3 times likely to have complications or die during pregnancy and childbirth as compared to any other ethnic group. And so that's very alarming that in this country, a country that has advanced medicine in so many ways, that it is still a problem for a woman of color to have a child. We're going into the hospital about to bear children, not knowing what's going to happen. And I had a personal experience with maternal morbidity. So again, now my coaching has evolved into not only can I help you get through this infertility process with IVF or IUI, whatever you choose to do, but I can also kind of help you move through your pregnancy, being aware of the things that you need to talk to your physician about to mitigate the maternal morbidity and mortality. And then when your baby comes, I can help you with what to do with the baby all day long. That's what I've been doing for almost 20 years. So I can certainly help you with how to take care of a newborn. So I have just found, Dr. V, that the coaching, I thought one thing, but God clearly had another plan. And so now I'm able to offer a wraparound service for women that are in a very vulnerable space from the perspective of being pregnant and, often having to go through IVF. But from a perspective of a physician, I understand all the terminology, all the drugs that are used, the jargon, the lingo, the procedures. I understand it, not only from a medical perspective, but also from a woman who's done it herself. And that makes a difference.
This has probably been one of the best podcasts I've had in a long time.
What? Oh my gosh.
It is amazing. It is amazing how you have turned every bit of your pain into purpose. Every bit of it. And I'm so proud of you. I am so proud of you. So proud of you.
All right. Now, don't you start, because I will cry right along with you now.
Listen. So tell us where we can find you. All right.
You can find me on all social media platforms. I am at The Doctor's Womb on Instagram, Facebook, TikTok even. Oh boy. But I also have a website, www.thedoctorswomb.com. And so my email address, Maya, MAYA, at thedoctorswomb.com. So I encourage your listeners, even if you are thinking about having to go through infertility and in the infertility process, please reach out. Let's talk about it. If I can just share some little nugget to help you along your way, I am always willing to do that. And I would love to have you in my coaching program to help you walk through this journey. There are a group of women that I coach now, and I've got about 60% now. It's going to be more than that soon because two of them are actually expecting their babies. But actually 60% success rate right now. Either we've got newborn babies that are in the world now or babies that are on their way. So I am so thrilled and honored to really be in this position, being able to help other women. It's been my honor.
Well, all I got to do is say, go follow Dr. Maya, and we love you. And
I love you too.
Right now.